meeting almost done and somebody barge in.
Okay.
The third most commonly diagnosed cancer and the second leading cause of cancer death in both men and women in the United States is colon cancer. The American Cancer Society estimates 136,830 people will be diagnosed in 2014 and 50,310 will die from colon cancer in the United States. Today I want to inform you about colon cancer and how it can be prevented. I plan to go in depth about what colon cancer is, how to prevent it, the signs and symptoms, and how it can be treated. I know that everyone in here has been affected by cancer in some way or another, myself included. When I was 2 years old, my mother was diagnosed with colon cancer. This was something that little did I know would have an impact on my life forever. My mom has currently been in remission for 17 years. Within the past few years, I have made it a goal to bring awareness to colon cancer and show everyone why this disease deserves just as much recognition as breast cancer, lung cancer, or any other disease. With that being said, I have done some research today to show you all just exactly how big of an impact colon cancer can have on your life if it is not treated properly. First, let's take a look at what exactly colon cancer is and what causes this disease. Colon cancer is defined as cancer of the colon or rectum, located at the digestive tract's lower end. Most colon cancers develop first as colorectal polyps. These are abnormal growths that grow inside the colon or rectum and can become cancerous. Only certain types of polyps can become cancerous. These are known as adenomas. Taking a polyp out early, when it is benign, may keep it from becoming cancerous. Now that we've established what colon cancer is and the cause behind the disease, we can go a little further in depth in examining the signs and symptoms. When it comes to the diagnosis of colon cancer, there are some common warning signs to look for. Many people with colon cancer experience no symptoms in the early stages of this disease. However, the most common symptom one can experience is rectal bleeding or blood in the stool. Though let it be known, there are certain instances in which rectal bleeding may be hidden. Changes in bowel habits are other common symptoms of this disease. If persistent abdominal discomfort occurs or a feeling that the bowels aren't completely emptying, seek medical advice. Now that we have discussed what colon cancer is and what causes this disease, let's talk about how to prevent this disease. Believe it or not, colon cancer is one of the most preventable cancers. The most effective way to prevent colorectal cancer is through early detection and the removal of benign polyps before they become malignant. Routine screening is the #1 way to reduce the chances of getting colon cancer. Beginning at age 50, it is recommended that people at average risk of colon cancer be screened at regular intervals by having a colonoscopy performed. A colonoscopy is a test that uses a colonoscope to examine the inside of the entire colon and rectum. The colonoscope is a flexible lighted tube that has a camera attached to the end. The tube is inserted into the rectum and the doctor can use the camera to take pictures of the inside of the colon. Taking medications to prevent a precancerous condition or to keep cancer from starting is another prevention method recognized by the Colon Cancer Alliance. Familial polyposis is an inherited disorder characterized by the early onset of hundreds of thousands of polyps throughout the colon. People with a first-degree relative who have a history of colon cancer are between 2 and 3 times more likely to develop this disease than someone without a family history. It is necessary to begin having routine colonoscopies before age 50 if familial polyposis is present. Now that you know how it can be found, let's talk a little bit about treatment options. Treatment options do vary depending on the stage of diagnosis. Most cases of colon cancer are not found in the early stages, unfortunately. This is attributed largely to the fact of how quickly this disease can spread or metastasize. There are 4 stages of this disease, with stage 1 being the least metastasized and stage 4 being the most. 40% of colon cancers are found at a local stage, 36% are found at a regional stage, and 20% are found at stage 4. The sooner the cancer is found, the easier it is to treat. When the cancer has progressed to a stage 4, there is only so much that can be done to treat this disease. Chemotherapy and radiation therapy are common treatment options for colon cancer. Chemotherapy is a drug treatment that uses powerful chemicals to kill the fast-growing cancer cells within the body. Radiation therapy is the use of radiation to control or kill malignant cells within the body. Surgery will be recommended if you are in the advanced stages of colon cancer. Part or all of the colon may need to be removed, depending on the severity of the case. However, the earlier this disease is detected, the fewer treatments a person will have to undergo. This is why routine screenings are so important. Today we learned that colon cancer can be one of the most dangerous forms of cancer, but also one of the easiest types to treat if caught early. In conclusion, I hope I have broadened your knowledge on colon cancer. You now know what colon cancer is, how to prevent it, the signs and symptoms, and also how it's treated. My mother waited too long to go to the doctor when she recognized she had blood in her stool. When she was diagnosed, she had stage 4 colon cancer, and she had to have surgery to remove all of her colon. She also underwent chemotherapy and radiation treatments over the months following her procedure. According to the Colon Cancer Alliance, there are currently more than 1 million colon cancer survivors alive in the United States. And with that, I'm proud to say that my mother